Well, Luke's now 33 years old and he's our second son. Luke was, he was born healthy, he was a good weight and born full term. Luke was a very easy, very placid baby and his milestones were early, both physical, his social and emotional, and in terms of his cognitive, were all above average at that stage. Luke started having seizures when he was 2.5 and he had up to 40 a day. And despite numerous hospital visits to some specialist hospitals in the country, some wonderful neurologists and a huge number of investigations, Luke has never had control of his seizures. He does suffer from behaviour changes before a seizure, what's known as pre-ictal behaviour, and he also has behaviour changes when there's intense electrical activity in the brain. The age of 6, 7, Luke was very ill with status seizures. We very nearly lost him, and his behaviour and his learning regressed from that stage. Luke has an extensive number of physical health issues. He had a twisted bowel, a leaking bowel, which resulted in a colostomy, now reversed. He has a huge number of abdominal issues. He also suffers from hemochromatosis, which is a build-up of iron in the body. He has a vagus nerve stimulator in his chest, implanted in his chest, and that was when he was about 13 to help him reduce the seizures, and there has been some impact of that. Luke has had invasive brain surgery to see whether surgery was an option, but it was an investigation. Unfortunately, there was nothing that could be done around that. Luke has been in induced coma 7 times due to seizures, and mainly due to seizures, but also other physical issues. And 3 of the times, we thought we were going to lose him. Luke entered the care system as an adult, and unfortunately his care has been complex and challenging. He's been exposed to a number of failed placements, and 3 of them were inadequate, one of them being Winterbourne View, and which was a highly publicised scandal at the time. And he suffered a huge amount of trauma from those 3 inadequate placements that he's been in. And I think there's been 17 placements in 13 years, I think it is. And this has obviously impacted on Luke's ability to build relationships and to trust people. So it's been a difficult time. Luke tried to express his concerns in his placements, but unfortunately he wasn't listened to. Luke moved into the community in 2019. He has 24-hour care support, and in 2022 the local authority did commission an independent review because of the recognised failings that Luke had experienced over a huge period of time. Luke, despite all that he's been through, is an intelligent, friendly, brave, the bravest person I know, incredibly resilient, and he's very thoughtful, he's very kind, he has a great sense of humour, and people who meet Luke say what a wonderful smile he has. He loves drawing and he makes books for a local school, and they write to each other, which is wonderful. Luke has a great love of wildlife and very knowledgeable about wildlife and nature, and he really enjoys gardening as well. We're very proud to call him our son, and throughout all the difficulties, we've never given up hope that things would improve for Luke. Well, Luke was out of county at the time. His placements have always been out of county, and he was referred to Shropshire IST in September 22, and the aim of that was to give support to the provider, to the carers, to the ICB, to Luke, to prevent an admission into a low secure hospital setting and to ensure that the placement didn't break down. There were also a number of safeguarding concerns that Luke had had over a number of years around the way the package was currently being delivered in particular. Luke was living in temporary accommodation, he was in the community, and there was restricted access at that time to staff, and he was being supported 3-to-1 in the community. There were some excellent staff, but there were also some very inconsistent staff. There'd be different people coming to the house. And bearing in mind that Luke had suffered huge trauma from staff that had worked with him over a number of years, to suddenly have a stranger come to his house at night and to be sitting in his house caused a huge amount of anxiety and stress to him. The support plans were not being read at the time, so the intensive support team, they worked with Luke, the providers, the ICB, with us, and their work was preventative to reduce a risk of crisis. And they've totally transformed Luke's life, and indeed ours. As I said earlier, Luke's journey has been very challenging because he's had a number of inadequate or requiring improvement providers who were slow to improve. However, throughout, we have come across some excellent staff, and both staff that were working with Luke, staff through the multi-agency approach, but in a way they were powerless to change anything because they were either in a role that they couldn't change it, or there wasn't enough joined up thinking and not enough working together to enable that to happen. We came across some wonderful doctors and nurses in hospitals. I'm talking around general hospitals where Luke had been for physical health needs, and their expertise, their experience maintained Luke's life on a number of occasions. And for the last 18 months, Luke has had a wonderful nurse in his care package, and that's really given Luke reassurance to him around his physical health needs. It's been a real consistency for Luke as well, and that has been a huge help to the package. We were involved in the transitions. Several transitions were made swiftly because of the inadequate and poor care that was being provided, and it was recognised by multi-agencies that this care was causing a grave concern to everybody. So we were involved, but they were often swift. We were told that in terms of the transition, we were told that the providers were strong providers. We were told that they had the skills, that they had the expertise to be able to work with Luke. They were very overpromised and under-delivered, I think is fair to say. And because a number of the moves were emergency moves, because of the concerns around what was being provided, there was little time for any transition in a number of cases. So they weren't successful. Luke, again, was moved to a provider where he didn't know the staff. They hadn't had an opportunity to get to know Luke. Again, there were inconsistencies with staff. And, due to those quick movements really and transitions, there wasn't the planning in place. So we were involved in the transitions, but sometimes there was inadequate planning, I suppose. Luke's most recent transition back into his home area, his home county, so far has been really successful because of the wonderful work of Shropshire Intensive Support Team who have worked with Luke and indeed ourselves. They absolutely have been a lifesaver to us. There was a lot of on-site training at the new placement. There was a lot of training for staff. There was a lot of work with the multi-agencies. And this really ensured that Luke's needs were understood, people were well trained, they checked the environment to ensure it was suitable. And so that transition home to the Home Authority has been hugely successful. And everyone now is really working together to support Luke. Well, when Luke first moved to a house in the community in 2019, there was little on-site support at all, really, because the care provider's management was based in Liverpool and the designated clinical lead was in Glasgow, and Luke lived in the West Midlands. So there were so few visits from management, both before COVID, because he moved into the community in 2019, during COVID and after COVID, because of the distance, there were very few management visits. And, you know, support staff were left on their own, and there were different staff each week. Some of them were lovely young people, but they were young support staff who'd had very little training. And the support workers phoned us most days because they couldn't get the heating to work, they couldn't get the plumbing to work, and there was no team leader in place for many, many months. And the locality manager was based in the south of England, and Luke, as I said, was in the West Midlands, and she worked with Luke for 2 years, but she'd never met Luke or ourselves. So it was all very much long distance, and it's, in my opinion, really difficult to have an effective care package when the management is so far away, you know, can't be trained, etc. And we were promised transport for Luke. That was part of the promise, and as I've said earlier, it was very much under-delivered. Staff had no transport, so I can remember numerous occasions when we were phoned, my husband and I, we were at work, and on one occasion Luke needed some emergency medication. We had to leave work, we had to travel the hour to get the emergency medication for his seizures. I can remember on another occasion there was no milk in the house, and there was no food in the house, and they had no transport. So again, we had to leave work and we had to go and get it. There was also, at the time, with the commissioners at the time, there was a lack of oversight and monitoring of the package. And this was recognised in the independent review of 2022. Well, I've mentioned a number, including the inadequate placements that Luke had. Something that was, for years, frustrated us really was the inaccuracy of report writing. And it was agreed at times that there was inaccuracy of report writing, but then they didn't get changed, and reports were carried forward from unit to unit. And these reports followed Luke round for 10 years, and there were inaccuracies in them. And he was given a label which was impossible to change. Many meetings were poorly run. We travelled long distances to attend, as Luke had placements out of county, and the meetings were often ineffective. I can remember several where there were no introductions at that meeting. We didn't know who the professionals were, and we felt quite outnumbered, I think is fair to say, really. Often there was no clear agenda at the meetings and the CPA reviews. So it was difficult for us to know, when we could speak, when we could actually give our viewpoint. Another point that was hugely frustrating with meetings was where documents, assessments, reports were not sent out beforehand. A week beforehand would be good practice. And so many times they were issued on the day. So a meeting would start at 10 o'clock and would be given them. Well, some of those reports would be 10 pages long. So there was no way we could read them, and it was very difficult then to challenge because we hadn't read them, but the professionals had read them. So that made it very difficult. We would then get home and think, oh, if we'd known that, we would have challenged, but of course we hadn't had the reports beforehand. And whilst there were regular meetings, and sometimes there were appropriate action points from those meetings, there were so many times where the action points were not monitored, they were not reviewed, the dates, the specific timescale just went by and nobody monitored them. And again, there was at the time, the commissioners at the time, a lack of oversight in terms of ensuring that action plans were monitored, that they were reviewed, they were followed up, and they were time specific. One time that we'll never forget was when Luke was it was the last meeting before Luke made a transition into the community, and we were sitting around at a transition meeting, and I suddenly looked around and I said to the professionals who were there, "How many of you have worked with Luke?" And there were none of the professionals who had worked with Luke, but they were talking about him. And the staff who'd worked with Luke were either absent, on holiday, wasn't their rota day. So people were talking about Luke, and they'd never worked with him. Another part really was the recording of incidents. Incidents would be recorded, this happened, but there was no investigation really of what was the trigger to that in terms of, did Luke have a seizure after? And he quite often did. What was the trigger to it? And any learning from it about what could be done differently? It was just, this happened. So there was no sort of looking into how things could have been done differently or what the trigger was. Little awareness, I suppose, of Luke's preictal seizure activity. I've talked about, the lack of oversight in terms of monitoring of them. Because Luke had his placement some distance from home, and we were often doing a 5-hour, round journey, there were few assurance visits to see that the provider was providing a safe care package, a good care package that met Luke's needs, that welfare was in place. And I've lost count of the number of safeguarding referrals that Luke had through his time, made by ambulance people, made by outside people, because they were concerned about Luke. I've talked around much being promised and under-delivered, and a number of placements said, we have psychiatric, we have psychological input, we have speech and language, we have occupational, we have sensory needs. But actually, when it came down to it, they did not deliver on those. And a number of places he was at, there was no speech and language, and I've already said that Luke has dysarthria. Luke has sensory issues, there was no occupational therapy. He didn't have an annual health check for 11 years. He didn't go to the dentist for 11 years. There was no podiatry. Luke has glasses. There were no opticians visited apart from when we took him. Luke is supposed to have checks on his hemochromatosis. It's very dangerous if he has too much iron in his body. He didn't have a check for 10 years in any of the placements. And obviously one of our concerns was that Luke was in so many placements that were poorly run. And despite our concerns, despite Luke very clearly expressing his concerns, we weren't listened to. And I know, and I'm sure that we did get perceived as difficult parents, nuisance parents. Accommodation wasn't always fit for purpose. Luke had dirty, cold rooms, showers that didn't work. And I can always remember when Luke had been in induced coma and been desperately ill. And he'd been in hospital for 3 weeks, been in intensive care unit. And we took him back to his placement. We picked him up and took him back. And the bed linen hadn't been changed. There was no fresh bed linen after 3 weeks. The bulbs in the bathroom had gone, and we said, could there be new bulbs? And we were told no, that the maintenance men would come later in the week. And that was just so incredibly distressing. Most of us, if we had been in intensive care and induced coma, we'd go home to loved ones, we'd go into a warm bed, we'd be given nice food, we'd have TLC. Luke went back to a room with dirty bed linen, into a dark room where he has epilepsy, so he could have a seizure in the dark, safeguarding concern in terms of health and safety, and also remembering that Luke has had abuse from some settings, and many of those happened in a bathroom, and he was expected for days to go into a darkened bathroom. There were little activities to keep Luke and the other service users occupied. Very few trips out. We have always taken Luke out in the community, can I say that? Whenever we've visited, we've taken Luke out. That's never been an issue. There were very few trips due to lack of staffing, lack of vehicles. Trips would be cancelled within 10 minutes notice, which is always disappointing for Luke, because there was no staff shortage, no transport. So there was very little in the way of activities given to keep Luke stimulated, to keep him interested. I think one of the most frustrating things has been through the last, I think it's 12 years actually, is that the inconsistency of staffing. Every report that has been written about Luke has stressed the importance of consistency of staffing. And that's for many reasons. One, because of his past history of trauma and abuse, but also because of his needs, his autistic traits. He needs the absolute consistent approach to working with him. And the inconsistencies of staffing have just been huge, really. Different people on different days, different people who had not read the support plan. They didn't have time for any training around Luke's needs, including emergency medication if he has a number of seizures. Little training of autism or no training, or of trauma-informed training. Luke experienced staff who were bullying and aggressive in their approach to him. And I can always remember, inconsistency of staffing when his first placement in the community. There was a support worker coming at night, never met Luke, and Luke was in a residential street, and he knocked on the doors all the way down the residential street. He didn't know Luke's name. He was saying, do you know where somebody lives with epilepsy? He needs a support worker at night and wants a male support worker. So that was absolutely shocking. One, confidentiality, but two, there'd clearly been no training because he had no idea of even Luke's name. So I've talked around the lack of oversight by the management and the commissioners, and his second home, there were no checks, there was no risk assessment, there was no visit for over a year into that home, and no health and safety checks, no environment checks. Was the environment right for Luke? And it probably wasn't. It was an emergency placement. So yeah, there's been a lot. Well, Luke's care it's been very distressing for us. We've always had hope that things would improve for him, and I think if we hadn't had hope, we may not have got through it. There's been huge sadness. Luke's had a different journey to the journey that we'd hoped. It's been awful to see him suffer, both from his physical health and from the placements he's had. Our smiley, vibrant, happy, cheeky son was reduced to a shadow of himself. And, to see him and to leave him, in units, we'd take him out for the day, and we've never had an issue with taking him out for the day, and then to leave him and trust him with the experiences he's had in some of the placements. I think there's probably regret. My husband and I, have devoted hours and hours to Luke, but regret that perhaps we weren't even more forceful when we knew things were not wrong. And then, when it came to light actually that he was in shocking placements, that we hadn't pushed that bit further. And, that regret that Luke was trapped in a system for 10 years and we couldn't get him out. And that was, 10 years of his early adult life. There's obviously the sadness of family occasions. We're a close family, and then, the sort of wider family, that Luke isn't there at family occasions, and, that included his brother's wedding, who he's very close to. There's been intense frustration that we haven't been listened to, and all the time we've been sending emails, etc. And you don't get a response, or there's no action from it. That's been very frustrating, and it's been frustrating that packages have not provided what they promised. They haven't delivered. Luke had his placements away from home. We live in a very rural area, in a very rural county, so his placements had to be away from home. So we've done a huge amount of travelling. We've always visited Luke at least once a week, usually at weekends, sometimes more when needed. And, we're fortunate that both my husband and I work, but we worked out that there's been a huge financial cost in terms of travel. We worked out, I think it was 110,000 miles that we travelled to visit Luke over 10 years. And as Luke was a distance from home, when he's been in intensive care units because of his induced comas, and when he's been very unwell in hospital, and he's had a huge number of hospitalisations into general hospitals, we have had to live in a hotel for quite a period of time. So I think 4 weeks was the longest. We had to pay for a hotel. We had to pay for food as well. So there's been a huge financial cost. When Luke first went into the community, there was no transport, which I think I mentioned earlier. And we had to spend at least £200 on taxis because he'd never get out otherwise, and there was no transport provided. Some of those taxis were staffed to go and get food for him as well. The first provider promised a house. The second house we had to find for Luke because they couldn't find one, and Luke was basically going to be homeless. So we had to pay £400 a month extra on the rent so that Luke could have a house at short notice. It was also at the start of COVID as well, so it was very difficult to find a placement. So yeah, huge financial cost. We worked out that we've lost 10 holidays and the cost of them, and that's been because Luke has been very unwell and been in general hospitals for his physical needs, and we haven't had the confidence that there was the staff consistency from the care provider to be with him, so we've rarely been on holiday. Another impact, I suppose, has been the lack of time for ourselves. We've had to take a huge amount of time from work, for meetings, for emergencies, when Luke's in hospital, when he's very ill. There's so many visits, meetings, hospital trips, and we've often worked at 2 o'clock in the morning to get our work done. That's the only way we can do it, to finish our work. And there's been lack of time for ourselves. We never have a weekend, as I said. However, things have improved recently and over the last few months, and we're hoping, we might find a weekend when we can do something, just normal things really. And we have booked a holiday abroad to go to a family wedding in later spring. So that's a real positive, that we feel confident that we can do that. There's another impact is the loss of family life. Luke's brother who's 2 years older, is a remarkable person, and we're hugely proud of what he's achieved in his career, but more importantly, the person he's become. And he's absolutely devoted to Luke. But it's been a different relationship because Luke has been so far from home. I mean, there is a positive impact in that Luke has taught us so much. I think we've learnt to have a strength from Luke, really. We've learnt to be incredibly resilient, and we no longer worry about small things because we found out what really matters. And I think Bill, my husband, and I, we've sort of very much worked as a tag team. That's a positive impact. We worked as a tag team really to get everything done for Luke, for home, for work. But Luke's, I think, taught us to have great strength and resilience. This was absolutely the turning point for Luke and ourselves. Without the input from the Shropshire Intensive Support Team, Luke would be living a very different life in a unit. The IST, Intensive Support Team, have been an absolute lifesaver, and they became involved when we were in a very desperate situation. We came across the most dedicated, caring, professional, experienced, knowledgeable team of people, and they were absolutely highly specialised and skilled, and we'll forever be grateful to them. I mean, initially when they met Luke, the IST thought, you know, they read the reports, hadn't met him at this stage, and they thought perhaps the reports might be correct. They interviewed a number of people. They interviewed the Integrated Care Board, the care provider, the staff, Luke, ourselves, and they got a balanced viewpoint. So they were getting everybody's viewpoint. However, they dug deeper and they absolutely challenged what was happening and very swiftly realised that things were seriously wrong, and there were things that absolutely were not right in the package, and they left no stone unturned. And I think, you know, I'd call it professional curiosity. They were really forensic, really, in Luke's case is what I think, in terms of they looked at everything in detail. They didn't just take something on its surface value. They asked those questions, and they were really challenging in the questions throughout meetings, through discussions. The whole team was absolutely fantastic, and the lead practitioner has been the most amazing person that we've met who's dealt with Luke, and you know, she absolutely knew that things were wrong, and she continually, as lead practitioner, asked those questions, and she challenged perceptions of Luke, that label of Luke, reports around Luke, and we actually called her a little Rottweiler because she was always asking those questions, always challenging. And you know, the intensive support team were and are so person-centred. They made numerous visits to see Luke, and you remember that I said that people in the past hadn't got to know Luke, turn up at a meeting, this is about Luke, they didn't actually know him, and in a short period of time really they made a number of visits with Luke. They very quickly engaged with him, and he got on really well with them. And you know, for them then to communicate with us that they'd found the wonderful young man that we knew Luke is. And they stripped away those labels, and they put Luke at the centre of all the work. And they realised his strengths, and Luke has many strengths, but they'd never been noticed before. We felt for the first time that we were listened to, and they included us in as much communication as they could and meetings that they could. And they were really approachable, and we didn't feel that we were nuisance parents, which, you know, we felt that that's what probably people thought about us. And again, they just gave us such hope that things would change, which they did very swiftly. And they engaged with the support staff. Luke has a nurse on his team because of his health needs at all times, and support workers. And they really worked with them to ensure that they were trained to meet Luke's needs, and so had an understanding of Luke overall, and he is complex. One of the things that was just so heartwarming really was we'd had so much negativity around Luke, so much negativity, and at all times they used positive language around Luke, and any of their discussions, their reports were factual, but they used that positive language. And with Luke, with the care staff, with the ICB, the providers, they're always using this positive language. And well, it was music to our ears, really. The reports, and I've spoken about reports, the reports that the intensive support team provided for meetings, for his transition, were of such a high quality. They challenged the reports of the care provider, of the ISB. They challenged what they were saying, they challenged the care that was provided. They, in a very short time, they carried out a range of assessments which were really useful for Luke's transition into his current home. And we also had a community treatment review, which is called a CTR. And a lot of their documentation was so useful for that because it was in such detail and it was really person-centred. It was around Luke. It wasn't a copy and pasted from previous reports. And they included a significant health review of Luke's needs and recommended a multi-professional review of his physical needs. They updated a support plan for Luke that was really positive, that was really personal to Luke, and they trained the staff in the delivery of that care plan as well. And their training for the support workers, but also for the receiving local authority and for ourselves, was really around understanding Luke, sort of looking at Luke's life through his eyes, really. And they did some wonderful trauma-informed training, which was to support Luke, so that everybody understood the awful journey he's had, really. And they were very supportive as a team, the IST, in terms of looking at his new environment, where he currently is and where he's doing really well. And they looked at the environment, they worked with the receiving local authority, the receiving IST team, etc., to ensure that the environment was suitable and was set up and was suitable. So, huge amount of work. And we had a CTR, and as I've said, the reports were really useful for that. But we had a very experienced independent panel on that CTR, and we're very fortunate that they were so experienced. And I can always remember their two comments. One was that they were shocked that the care had been provided in such a way. And they said it was the longest CTR that they'd ever had, with the most recommendations. And, you know, much of that information was provided by the IST. And another comment at that CTR was from the panel was that the person they met, because they went to meet Luke, was a very different person to the person that they'd read about. And they'd met a chatty, smiley, hospitable, funny, and they used the words, marvellous young man. And the IST as well were very prompt in addressing any of the actions that were supposed to be time specific. So they really ensured that they happened in that time frame as well. So things markedly improved because actions were not just being set, they were being addressed, and they were time specific as well. We felt, you know, the IST, for the first time we were really listened to, that our viewpoints mattered, and actually that there was some value in what we were saying, that we had the knowledge of Luke, we had expertise around Luke, you know, we've had Luke, you know, all our life. We really felt that the IST team valued our opinions, valued our information, and that we had a lot to offer, and that we would work as a team around it. An example of that was when the IST were first involved, there were unnecessary restrictions, and we were very concerned around that, and we had for many months expressed our concern. So the IST team went to the house to see what was happening rather than just a report. They checked it out, they discussed with staff, and they really agreed that those restrictions were totally inappropriate. And another example really was around inconsistency of staffing, which I've mentioned, you know, many times. And we talked around the impact that if Luke does not have staff with him who are trained for all his needs, but Luke feels secure with, he becomes anxious. So they looked into training, they stressed the importance of consistent staff, and they looked into it and they made very challenging recommendations, really. And there were also at the time some inaccuracies of reporting of incidents, and it was agreed that they were inaccurate, but they were written down, and the IST team ensured that those inaccurate reports were changed. So they were investigated so that they didn't move through Luke's history again. So they were absolutely wonderful in terms of listening to us as parents, and we really had such hope when we first met them. Yeah, I mean, the intensive support team have changed Luke's life and our life. He could have been condemned to another unit, but as a result of the incredible work, Luke has transitioned between the two counties. There's been a huge amount of work and such a positive impact. Everybody's working together now. He's back in his home area. The provider, the staff, the ICB, the current IST, multi-agencies and ourselves to provide the best outcomes for Luke. So everybody's really working together, which is so positive after many years of struggling and challenge. At the current time, Luke is living in a house for life in a rural community, which he loves. He does like to be in a rural community. He has a team of skilled, trained staff who understand Luke and understand the trauma, understand the complexity of Luke. The team is led by a wonderful nurse who's worked with Luke for 18 months. The various agencies are having regular meetings. They have a very positive view of Luke, and they involve us in the meetings. They listen to our viewpoint. We're very much listened to. There's such a marked improvement, and only yesterday there was a meeting, and I think it's called the Complex Needs team commented everything was positive in that meeting. So there's been a marked improvement. And although Luke has considerable physical health needs, he's so happy, he's really enjoying himself, he feels safe, and after all that he's suffered, he really does feel safe. He's benefited hugely from a consistent staff team, and just to see that smiling, happy face in an environment that he loves is just a joy to see. And Luke is a total inspiration, and we're so proud of him, and we're glad we never gave up that hope.